This is Dr. Rajni Mandal with Pathology Watch, here with your 3D 3-minute digital dermatopathology digest. Today's topic is Warty Dyskeratoma. Warty Dyskeratoma commonly presents as a solitary and sometimes umbilicated papule on sun-exposed areas of the head and neck. It is an endophytic lesion seen here growing into the skin. It can be also cup-shaped and can be centered around a follicle, as this case, where you can see a hair shaft in the center of the lesion. The warty portion of a warty dyskeratoma is seen here with papillomatosis as well as hypergranulosis. Warty dyskeratomas are characterized by acantholytic dyskeratosis. Dyskeratosis means premature keratinization of keratinocytes characterized by dense eosinophilic cytoplasm, as seen here. Core rons are dyskeratotic cells that still have a rounded nucleus, whereas core grains are dyskeratotic cells with a flattened nucleus like a grain of rice, as seen here. Warty dyskeratomas also show villi projecting into the lesion, as well as a central keratin plug. This is a warty dyskeratoma not centered around a follicle, and you can see here the cup-shaped lesion with a keratin plug. There is surrounding hypergranulosis as well as papillomatosis. And you can see here there's suprabasilar clefting with acantholysis and acantholytic dyskeratosis. Due to the staining here, the dyskeratotic cells don't show as eosinophilic cytoplasm, but you can appreciate the density or the hard cytoplasm here. This is a core ron with a rounded nucleus, and here's a core grain with a flattened nucleus. So here are your 5 flashbacks for warty dyskeratoma. It commonly presents as a solitary and sometimes umbilicated papule on sun-exposed areas of the head and neck. It is endophytic, can be cup-shaped, and can be centered around a follicle. It is characterized by acantholytic dyskeratosis, suprabasilar clefting, and villi. It has a similar histological appearance to Derrier's disease with acantholytic dyskeratosis, with core grain and core ron. And it has a central keratin plug. Here's your bonus review question for today. A skin biopsy of a lesion on the face shows acantholytic dyskeratosis. Which features support the diagnosis of warty dyskeratoma? A. Multiple pruritic lesions. B. Enlarged nuclei in the basal layer. C. Columns of parakeratosis. Or D. A solitary lesion. The answer is D. A solitary lesion, which is the clinical appearance of a warty dyskeratoma. Multiple pruritic lesions are seen in Grover's disease, which can also show acantholytic dyskeratosis. Enlarged nuclei in the basal layer can be seen in actinic keratosis, which can also show acantholysis. And columns of parakeratosis are commonly seen in porokeratosis. That's it for me for today. This is Dr. Rajni Mandal with Pathology Watch, revolutionizing pathology for dermatologists. Check us out at pathologywatch.com.